Let's talk about the extremities. When you have an injury to the extremities, primarily a gunshot, could be a knife, could be blunt trauma, but gunshot is you could really injure a lot of structures. One of the things that you have to be most worried about injuries in the extremities is the vascular supply, because you don't want the leg to die. So let me ask you a question. If you have pulses, does that mean that you have not injured your arterial system? No. Therefore, you have to do Dopplers. You have to do Dopplers to determine whether or not you might have an injury. And if there is any question, you do an angiogram. You could do a CT angiogram, but usually they do a regular angiogram for the extremities because you don't want to get into a problem with ischemia. All right. So therefore, remember, if you have especially with a gunshot, if you have abnormal Dopplers, you're going to angiography. But in general, we sometimes think about the three things that you could injure in an extremity. What are they? Vascular, nerve, and bone. Vascular, nerve, and bone. Okay? Well, years ago, when patients had vascular, nerve, and bone injuries to the extremities, what we would do is common horse sense would tell you, well, the most important thing is the arteries. So we'd fix the arteries first. Then we do the nerves. And then the last thing, we'd have the orthopedic surgeons come in and do the bone. Arteries first for blood supply, nerve, and then bone. And what we found was that when the orthopods came in to do their bone repairs, they tore our anastomoses of our blood vessels. And it's not because of them. It's, if you ever look at orthopedic surgery, they have to align things and move things around. And so therefore we realize that we can't go first when there is artery, nerve, bony injury. So now the order is this: BAN, bone, artery, nerve. Bone, artery, nerve. And when a patient cuts off their arm and it gets sewn on, yeah, ortho goes first because they have to manipulate. They have to manipulate the bone to a certain extent to get everything right. Then we do the arterial anastomoses and the nerve anastomoses. Now, during the time that the orthopod is working, we may put in a shunt, meaning a conduit, a tube from one part of the blood vessel to the other to maintain flow. But we don't repair it until after they're done. Now, a very, very important subject. We then talk about, in terms of extremities and the whole body, crush injuries. What do I mean? Well, can you get a crush injury to your muscle without breaking bones, without injuring blood vessels and nerves? Oh, yeah. Oh, you can. And crush injuries are dangerous because crush injuries release three things. They release acid, potassium, and myoglobin. The acid and the potassium is not good for the heart. And what does the myoglobin affect? the kidneys. So therefore, a crush injury where the muscle is injured from a crush releases acid, potassium, and myoglobin, and has to be treated. And how do you treat that? You treat it, number one, by hydration. Number two, by diuretics. And number three, alkalinization of the urine. Let me repeat those three things. You treat a crush injury by hydration, diuretics, and alkalinization of the urine. Now, you might think, well, crush injuries of the extremities, they're not terribly common without, bony injuries and things, and you're right. But you know where you get crush injuries and see them a lot? You see them on people who are either injured, drunk, or on drugs, and they're lying on a hard floor. You will get a crush injury. You will get a crush injury. Meaning, you might say, well, hell, I've slept on a floor before. Yep. And I didn't get a crush injury. Yep. That's correct. Because what do you do when you feel discomfort? You move. When you're in bed and you feel discomfort, you move. But if you're injured, drugged, or drunk, you won't move. And guys, some of the worst crush injuries that I have seen are people who are drunk or on drugs or on a hard surface for a protracted period of time. And I'll just tell you recently about a story. A young lady, very nice young lady, her boyfriend just beat the hell out of her, broke her jaw, broke her zygoma, knocked her out, and left her in their apartment. And she was unconscious on the hard floor. And she was knocked out. She had a bad concussion, and she was unconscious. And her mother found her the next day, brought her in the emergency room. And yes, I had to wire her jaw and fix her zygoma. But the main thing is she had a major crush injury from lying on the hard floor, didn't move, and she was in renal failure and had to be dialyzed. And so, in other words, I want you to understand that you will see crush injuries, meaning in scenario like that. So it's really something you have to be aware of. And I'll tell you a quickie story. One of my wife's friends, their dog was behind this guy's car, and he ran over the dog. The dog was behind the car, didn't know he ran over the dog. And then, you know how sometimes you feel a bump and you don't know, you think, so went forward again and ran over the dog again. And they took the dog to the vet, and there were no broken bones. And I don't know what the vet was thinking about, but obviously the dog had a crush injury. The dog should have been put into the vet hospital and hydrated, et cetera, just like a human. And they sent the dog home, and the dog died. The point is, guys, crush injuries, you gotta recognize that if you are on a hard surface and you don't move for you're drunk or on medications, you will get this problem. So just remember that, all right? Don't forget that.